Welcome to The Explainer. Today we're going to tackle a condition known for its absolutely debilitating pain, trigeminal neuralgia. It's a diagnosis that can be really tough to get and even tougher to live with. So we're going to shed some light on what it is, what's causing it, and most importantly, how it's treated.
So to really wrap our heads around this, we have to start with the pain itself. And let me be clear, this is no exaggeration. Trigeminal neuralgia is widely considered one of the most painful conditions known to medicine. We're talking pain so severe people compare it to a heart attack or even childbirth.
So, what exactly is this condition that causes such an extreme level of pain? Let's dive into the specifics of what patients are actually going through. At its core, trigeminal neuralgia, you might also hear it called Tegretol neuralgia, is all about the trigeminal nerve. That's your fifth cranial nerve, and its main job is to send all the sensations from your face, touch, pain, temperature, up to your brain. And here's what makes this pain so unique and so terrible. It's not a dull, constant ache. Nope. It comes in these sudden, brutal attacks, like an electric shock or a lightning bolt that lasts for just a few seconds. It's also almost always on just one side of the face, usually hitting the cheek or the jaw area. Okay, so if the pain comes and goes in these attacks, what sets them off? Well, this is where it gets really tough for patients, because the triggers are often just normal parts of daily life. I mean, just think about this. Brushing your teeth, smiling at a friend, even a light breeze hitting your face. Any of these completely harmless things can set off an episode of that agonizing pain. You can just imagine the kind of fear and anxiety that creates, where people start avoiding simple, everyday activities. So, why? Why does this happen? What is going on inside someone's head that causes such a severe reaction to something so simple? Well, the answer, it turns out, is basically a kind of neurological short circuit. To really get this, let's use an analogy that a bunch of the neurosurgeons in our sources use. Picture the trigeminal nerve like an electrical wire, complete with its own protective insulation. Now imagine a blood vessel is right up against that wire, and with every heartbeat, it's just pulsating against it. Over and over, day in and day out. That constant rubbing can literally wear away the nerve's protective coating, the myelin sheath. This leaves the nerve exposed, raw, and it starts to short circuit, firing off these absolutely brutal pain signals. And get this isn't some rare fringe cause. It is the cause, by a long shot. We're talking a staggering 80 to 90% of cases are caused by exactly this, a blood vessel physically compressing that trigeminal nerve. So yeah, that vascular compression is the #1 culprit by far, and it's usually the superior cerebellar artery for those curious. But it's not the only thing that can cause it. Multiple sclerosis can damage that myelin sheath in a similar way, and in some rarer cases, a tumor or another kind of lesion could be the source of the pressure.
You'd think with symptoms this specific, getting a diagnosis would be a piece of cake, right? Well, it can actually be surprisingly tricky. So how do doctors figure it out for sure?
Unlike a lot of conditions, there's no single blood test or scan that just spits out the answer. As one neurologist put it, the diagnosis is in the room. The single most important tool is just listening, really listening to the patient's story.
So clinicians are basically running through a mental checklist. Does the pain feel like an electric shock? Check. Is it brief and comes in waves? Check. Is it only on one side of the face? Check. And is it triggered by things that shouldn't cause pain, like a light touch? Big check. And what's really telling is that a normal neurological exam is, well, normal. That helps rule a lot of other things out.
Okay, so if it's all about the story, why do an MRI? Well, it's essential for playing detective. You have to rule out those other, less common causes we mentioned, like a tumor or signs of MS. Plus, with today's high-resolution imaging, doctors can often actually see that little blood vessel right up against the nerve, confirming the diagnosis.
All right, now for the most important part, the part everyone wants to know. What can you do about it? And the good news here is that even though the pain is off the chart severe, there are some really effective ways to find relief. The treatment journey usually follows a pretty clear path. The first stop is always medication. But if that stops working, or the side effects are just too much, then it's time to talk about surgical options.
Now this is absolutely critical. Your typical painkillers, ibuprofen, even opioids, they just don't work. The pain isn't coming from a muscle, it's nerve pain. So the drugs that do work are actually anticonvulsants, like carbamazepine. They work by calming down that overexcited, short-circuiting nerve and slowing down the pain signals. So what happens when the meds just aren't cutting it anymore?
That's when surgery becomes a really powerful option. The gold standard is called microvascular decompression, or MVD. It's such an elegant fix. You have a mechanical problem, the artery hitting the nerve, so you do a mechanical fix. A surgeon literally goes in and places a tiny Teflon cushion between them. Then you have less invasive options, like a rhizotomy, where they carefully damage the nerve root with heat or chemicals just enough to block the pain. And finally, there's stereotactic radiosurgery, or gamma knife, which uses a super-focused beam of radiation to do a similar thing without making a single cut.
And here it is, the most hopeful number in this whole explainer. For the right patient, that person with the clear-cut blood vessel pressing on the nerve, MVD surgery has an initial success rate of over 90%. That is incredible. It's one of the few times a surgeon can look at a patient in horrible pain and honestly tell them, we can probably cure this.
Okay, we've covered a lot of ground. So, what are the big things to remember here? What are the key takeaways from all this?
So, let's just run through it one more time. First, the pain is unique, that severe electric shock on one side of the face. Second, the cause is usually physical, a blood vessel literally bumping into the nerve. Third, the diagnosis comes from the patient's story, confirmed with an MRI. And finally, and most importantly, while normal painkillers don't work, there are specific meds and highly effective surgeries that can offer real long-term relief.
Which really just leaves us with this final thought. For a condition that is defined, literally, by pain, how much does getting a clear diagnosis and the right treatment transform a person's entire world? When simple things like talking, eating, or smiling cause agony, the answer is completely. It's just a powerful reminder that by understanding the deep mechanics of a disease, we can do more than just manage it. We can truly give someone their life back.